The mortar shell exploded 40 meters from the field hospital, close enough to rattle the surgical instruments on their sterile trays and send a fine layer of dust cascading from the tent ceiling. Staff Sergeant Maria Elena Vasquez didn't even flinch. Her hands remained steady as she sutured the shrapnel wound on the young soldier's arm, her concentration absolute despite the chaos erupting around their remote outpost in the mountains of Afghanistan. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow, I've saved something extra special for you. Incoming! Someone shouted from outside, but Maria had already moved, her body instinctively shielding her patient as another explosion thundered across the valley. The wounded private beneath her hands was 19 years old, barely older than her youngest brother back in El Paso, and she'd be damned if she let him bleed out because some insurgents decided to test their aim. "Easy there, Rodriguez," she murmured to the soldier, her voice calm and reassuring despite the violence outside. "Just a little fireworks show. We'll have you patched up and back to annoying your squad leader in no time." Private Rodriguez managed a weak smile through his pain medication haze. "Thanks, Sergeant. You've got steady hands for someone who's just a medic. Just a medic." The phrase had followed Maria through 3 deployments, echoing in briefing rooms, chow halls, and command posts across 2 different countries. To the infantry, she was just a medic. To the officers, she was just a medic. Even to some of the other medical personnel, she was just an enlisted soldier with basic medical training, not someone whose opinion carried weight when real decisions needed to be made. What they didn't know, what Maria had never felt the need to advertise, was that before enlisting in the Army, she'd completed 4 years of pre-med at University of Texas, graduating summa cum laude with a degree in biochemistry. She'd been accepted to Johns Hopkins Medical School, Harvard, and Stanford. She'd spent 2 summers working in trauma centers in Houston and Dallas, observing surgeries and learning from some of the best doctors in the country. But when her father lost his job at the factory and her family faced losing their house, when her younger siblings needed someone to help pay for their education, Maria had made a choice. She'd enlisted instead of going to medical school, trading her dreams of becoming a surgeon for the immediate financial stability that military service could provide her family. The Army had trained her as a 6'8", a combat medic, and she'd excelled beyond anyone's expectations. But excellence in applying pressure bandages and administering morphine wasn't the same as the respect accorded to doctors or even to the seasoned NCOs who led infantry squads. To most people, she was support personnel, valuable but not essential, skilled but not irreplaceable. Maria finished Rodriguez's sutures with practiced efficiency, each stitch perfectly placed and tied. Her movements were economical and precise, the muscle memory of countless hours spent in anatomy labs and emergency rooms guiding her hands. She'd learned early in her deployment that confidence and competence could coexist with humility, that sometimes the best way to help people was to let them underestimate you while you quietly did whatever needed to be done. Vasquez, the voice, belonged to Captain Patricia Wells, the head nurse who ran the medical operations at Forward Operating Base Mitchell. Wells was a career military nurse with 15 years of experience and little patience for enlisted medics who she believed didn't understand the complexities of real medical care. "I need you to inventory the morphine and prepare the casualty reports from yesterday's convoy incident." "Roger that, ma'am," Maria replied, securing Rodriguez's bandages and making notes on his chart. "I'll have the reports ready within the hour." "Captain." Wells barely acknowledged her response, already turning to speak with Dr. Benjamin Foster, the surgeon who'd been assigned to their remote outpost. Foster was competent enough, Maria supposed, though she'd noticed his hands sometimes trembled during complex procedures, and his decision-making could be slow under pressure. He was, however, a commissioned officer with a medical degree, which automatically placed him several rungs above an enlisted medic on the military Hierarchy. Maria gathered the morphine inventory sheets and headed toward the supply tent, passing through the controlled chaos that defined life at Phoebe Mitchell. The base was small even by military standards, home to fewer than 200 soldiers tasked with providing security and humanitarian assistance to the scattered villages throughout the Kunar province. The medical facility consisted of 3 connected tents that served as triage, surgery, and recovery areas, along with a separate tent for supplies and administrative work. The base's location in a narrow valley surrounded by steep mountains provided excellent defensive positions but also created significant vulnerabilities. Supply convoys had to navigate treacherous mountain roads that were perfect for ambushes, and medical evacuations were dependent on helicopter flights that could be grounded by weather or enemy activity. When things went wrong at Phoebe Mitchell, the medical staff often had to handle situations that would normally be managed by much larger hospitals with more resources and personnel. As Maria counted morphine vials and updated inventory logs, she reflected on the strange irony of her situation. She'd joined the military to help her family financially, but the work itself had become something more than just a job. Every wounded soldier who came through their doors represented someone's son or daughter, someone's brother or sister. The young faces reminded her of her own siblings, and the responsibility of caring for them had awakened something in her that went beyond duty or obligation. She'd started reading advanced medical texts during her off hours, ordering textbooks online and having them shipped to whatever FOB she was stationed at. She'd studied surgical techniques, memorized anatomical details, and learned about trauma procedures that went far beyond her official training. Not because anyone had asked her to, but because knowledge felt like the best way to honor the trust that wounded soldiers placed in her hands. Dr. Foster appeared in the supply tent doorway, looking harried and tired. "Vasquez, do you have those? Pain medication counts? I need to update the medical supply requests for the next convoy." "Almost finished, sir," Maria replied, handing him the completed forms. "I also noticed we're running low on surgical sutures, particularly the 3-0 monofilament. Might want to add those to the request." Foster glanced at the forms without really reading them. "Right, sutures. I'll make a note." He paused, seeming to notice something in her tone. "How did you know we were low on monofilament specifically?" I've been tracking usage patterns since last month, sir. We go through about 30% more 3-0 monofilament than the other suture types because of the wound patterns we typically see. Shrapnel and small arms injuries require finer suturing for optimal healing, and the monofilament reduces tissue reaction compared to braided alternatives. Dr. Foster stared at her for a moment, as if seeing her for the first time. "That's very detailed analysis for a medic, Vasquez." Maria kept her expression neutral. "Just trying to be thorough, sir." After Foster left, Maria returned to her work, but the brief interaction lingered in her mind. She'd learned to be careful about displaying too much knowledge or expertise. Military hierarchies were delicate things, and enlisted personnel who appeared to know more than their superiors could find themselves facing resentment or suspicion. Better to be competent but unassuming, helpful but not threatening. The afternoon brought a steady stream of routine medical cases, soldiers with minor injuries from training exercises, altitude sickness from the high mountain environment, and the various ailments that affected people living in austere conditions. Maria treated each patient with the same careful attention, whether they needed antibiotics for an infection or just someone to listen to their concerns about home. Private First Class Amanda Thompson, a communication specialist, arrived complaining of severe abdominal pain that had been building for 2 days. Maria's examination revealed classic signs of appendicitis, right lower quadrant tenderness, rebound pain, and an elevated white blood cell count from the blood work she'd ordered. "I need to get Dr. Foster," Maria told Thompson, helping her lie down more comfortably. This looks like appendicitis, and we need to get you to surgical intervention as soon as possible. Thompson's face went pale. Surgery? Here? I thought you guys just did basic stuff. Dr. Foster is a qualified surgeon, Maria assured her, though privately she was already running through contingency plans. Foster could handle an appendectomy under normal circumstances, but Maria had noticed his increasing nervousness during complex procedures lately. The stress of deployment was affecting him, and she wasn't sure how he'd perform if complications arose. When Dr. Foster examined Thompson, his diagnosis confirmed Maria's assessment. Acute appendicitis, he announced. We'll need to schedule surgery for this evening when the OR is available. Sir, Maria said carefully, given the patient's presentation and the progression of symptoms, might it be better to operate sooner? Appendicitis can progress to perforation quickly, especially under the physiological stress of this environment. Foster looked annoyed at being questioned. Sergeant, I'm well aware of the progression of appendicitis. The surgery can wait until our normal evening schedule. Maria nodded and said nothing more, but she made a mental note to monitor Thompson closely for any signs of deterioration. If the appendix perforated while they waited, what should have been a routine surgery would become a life-threatening emergency. As evening approached and the mountains cast long shadows across the valley, Maria prepared the surgical suite for Thompson's operation. She'd assisted in enough procedures to know exactly how Dr. Foster preferred his instruments arranged, what sutures he typically used, and how he liked the lighting positioned. Her movements were efficient and professional, the result of months of experience working in a high-tempo medical environment. Dr. Foster scrubbed it in, with Captain Wells assisting, while Maria took her position as the circulating nurse, responsible for maintaining sterile technique and providing whatever instruments or supplies might be needed during the procedure. It was a support role, important but secondary, exactly what was expected of an enlisted medic. The surgery began normally enough. Foster made his incision and began the careful process of isolating the appendix. But Maria could see the subtle signs of his nervousness. Slightly trembling hands, paused decisions, a tension in his movements that suggested uncertainty. When he encountered some unexpected scar tissue from a previous injury, his hesitation became more pronounced. Sergeant, I need better visualization here, Foster said, his voice tight with concentration. Can you adjust the lighting? Maria repositioned the surgical lights, but she could see that the real problem wasn't visibility. Foster was struggling with the anatomy, uncertain about how to safely remove the appendix without damaging surrounding tissue. His incision was less precise than it could have been, and his tissue handling was causing more trauma than necessary. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Thompson's vital signs remained stable, but Maria found herself mentally cataloging every aspect of the procedure, noting where she would have made different choices, how she might have approached the technical challenges Foster was facing. Her pre-med education and extensive independent study had given her knowledge that she rarely had the opportunity to use, but it was all there, waiting just beneath the surface. The operation lasted longer than it should have, and when Foster finally removed the appendix, Maria could see that his technique had been adequate, but not optimal. Thompson would recover fully, but with more scarring and discomfort than necessary. It was the kind of result that highlighted the difference between basic competence and true surgical skill. As they cleaned up after the procedure, Captain Wells made her usual post-operative comments. Good work, doctor. Nice clean appendectomy. She glanced at Maria dismissively. Vasquez, make sure all the instruments are properly cleaned and sterilized for tomorrow. Yes, ma'am, Maria replied, already beginning the process of breaking down the surgical setup. Just a medic responsible for the cleanup after the real medical professionals had done the important work, but as she carefully cleaned each instrument, checking for proper function and organizing them for sterilization. Maria found herself thinking about the surgery she'd just witnessed. Foster had succeeded, which was what mattered most, but she couldn't shake the feeling that she could have done better. Not because she was smarter or more talented, but because she'd spent years studying surgical techniques with the kind of intensity that came from genuine passion rather than obligation. That night, as Fob Mitchell settled into its nighttime routine of guard rotations and equipment maintenance, Maria lay in her bunk reading a surgical textbook by flashlight. The book was Advanced Trauma Surgery by Dr. Catherine Morrison, a renowned trauma surgeon who'd revolutionized emergency surgical techniques in civilian hospitals. Maria had read it cover to cover 3 times, memorizing procedures and principles. That went far beyond anything she'd been taught in military medical training. Around her, the other soldiers in her tent slept or quietly pursued their own off-duty activities. Some wrote letters home, others played handheld video games or listened to music through headphones. They were good people, dedicated soldiers who took their duties seriously, but none of them spent their free time studying advanced medical procedures or memorizing anatomical details. Maria wasn't sure why she felt compelled to push herself beyond what was required or expected. Part of it was probably the influence of her parents, who had always emphasized education and excellence despite their own limited opportunities. Part of it was the knowledge that the soldiers under her care deserved the best possible medical attention, regardless of the limitations imposed by military hierarchy or resource constraints. But increasingly, Maria was beginning to suspect that her drive to learn and improve came from something deeper. Every time she watched a surgery or treated a complex injury, she felt a sense of clarity and purpose that was unlike anything else in her life. The technical challenges energized her, the responsibility focused her mind, and the opportunity to help people heal gave her work a meaning that transcended mere duty. She was just a medic, according to everyone around her. But late at night, studying surgical techniques and dreaming of the procedures she might someday perform, Maria began to wonder if maybe she was something more. Maybe she was a surgeon who just happened to be wearing a medic's uniform, waiting for the right moment to prove what she was truly capable of achieving. The mountain wind whistled through the gaps in the tent walls, carrying with it the sounds of a remote military outpost at night. Generators humming, radio chatter from the command post, the distant sound of helicopters returning from evening patrols. It was the soundtrack of deployment, familiar and oddly comforting in its consistency. Tomorrow would bring new challenges, new patients, and new opportunities to demonstrate her competence within the carefully defined boundaries of her role. But tonight, Maria continued reading about surgical procedures she might never be allowed to perform, building knowledge and expertise that might never be officially recognized, preparing for possibilities that existed only in her imagination. She was just a medic. But sometimes, in the quiet hours between midnight and dawn, she allowed herself to dream of being something more. The emergency siren shattered the pre-dawn quiet at 0347 hours, its piercing wail echoing off the surrounding mountains like a banshee's cry. Maria bolted upright in her bunk, muscle memory from 3 deployments instantly orienting her to the sound's meaning. Mass casualty event. Multiple wounded incoming. She was dressed and running toward the medical facility before the second blast of the siren finished reverberating through the valley. Around her, FOB Mitchell erupted into controlled chaos as soldiers emerged from their quarters, grabbing weapons and equipment with the practiced efficiency of a unit that had been tested by fire more times than anyone cared to count. All medical personnel to stations immediately. Captain Wells' voice crackled through the base-wide communication system. Multiple casualties inbound, ETA unknown. Prepare for trauma protocol level 1. Maria burst through the medical tent entrance to find organized pandemonium. Captain Wells was already pulling surgical instruments from storage, while Dr. Foster stood frozen beside the radio, his face pale in the harsh fluorescent lighting. The radio operator was trying to establish communication with the incoming casualties. Static and broken transmissions filling the air with urgency and confusion. "What's the situation?" Maria asked, immediately beginning to set up triage stations without waiting for orders. "Convoy ambush approximately 12 clicks northeast." Wells replied tersely, her hands moving automatically through equipment checks. 3 vehicles, unknown number of casualties. Radio communication is intermittent, but initial reports suggest multiple serious injuries. Dr. Foster finally moved, his voice strained as he spoke into the radio handset. "Romeo 7, this is Mitchell Base Medical. Please confirm casualty count and injury assessment." The response came back broken and distorted. "Mitchell Base. Romeo 7... tagging heavy fire. Multiple casualties. Need immediate... lost audio contact with the lead vehicle." The transmission dissolved into static, leaving them with fragments of information and a growing sense of dread. Maria continued, preparing medical stations, her hands working automatically while her mind processed the implications. Convoy ambushes in this region typically involved improvised explosive devices followed by small arms fire. The injuries would be severe: blast trauma, penetrating wounds, possible amputations, and the kind of complex injuries that required immediate surgical intervention. "Dr. Foster," Maria said carefully, "should I prepare the surgical suite for multiple procedures? If we have several critical cases coming in simultaneously." Yes, of course," Foster interrupted, but Maria could see the tension building in his shoulders. She'd worked with him long enough to recognize the signs of stress that preceded his decision-making paralysis. Under normal circumstances, with one patient and adequate time for preparation, Foster was competent. But mass casualty events demanded quick decisions, precise techniques, and the ability to prioritize care under extreme pressure. The sound of helicopter rotors filled the air, growing louder as the medevac aircraft approached the landing zone. Maria felt her pulse quicken, not from nervousness but from anticipation. This was what all her training and study had prepared her for, the moment when theoretical knowledge would be tested against the brutal reality of combat injuries. "First bird inbound," someone shouted from outside. "2 critical, 1 urgent, 1 delayed." Maria positioned herself at the entrance to receive the casualties, her mind already shifting into the analytical mode that had served her well throughout her deployment. 4 casualties from 1 helicopter meant more aircraft were coming, probably carrying the wounded from the other vehicles in the convoy. They were about to face the kind of medical challenge that would test every member of their small team. Stretcher bearers rushed through the entrance carrying the first patient, a young specialist whose left leg was mangled beyond recognition. Maria's trained eye immediately assessed the injury: traumatic amputation below the knee with significant tissue loss and active bleeding from multiple arteries. This soldier would need immediate surgical intervention to control hemorrhaging and prevent shock. "Bay 1," she called out, directing the stretcher team toward their most advanced surgical station. "Dr. Foster, we need immediate vascular control on this one." The second casualty was conscious but pale, holding pressure on a penetrating abdominal wound that had soaked through multiple field dressings. Maria could see the telltale signs of internal bleeding, dropping blood pressure, rapid pulse, and the grayish pallor that indicated significant blood loss. "Bay 2, she directed. "Captain Wells, this one needs immediate assessment for internal bleeding." The third patient was ambulatory but disoriented, with obvious signs of concussion and multiple lacerations from flying debris. The fourth showed classic symptoms of blast lung injury: difficulty breathing, bloody sputum, and chest pain that suggested pulmonary damage from the pressure wave of an explosion. Before Maria could fully process the first 4 casualties, the sound of additional helicopters filled the air. The second wave was arriving, bringing more wounded soldiers who would need immediate care. She quickly surveyed their current capacity. Dr. Foster was beginning to work on the amputation case. Captain Wells was assessing the abdominal wound. And Maria was responsible for triaging additional casualties while managing the 2 remaining patients from the first helicopter. Mitchell Base, this is Angel Flight 2, came the radio call from the approaching aircraft. We have 3 critical and 2 urgent casualties inbound. One of our criticals is touch and go, possible internal bleeding, vital signs deteriorating en route. Maria felt her stomach drop. They were already at capacity with the first 4 casualties, and 5 more critical cases were about to arrive. Dr. Foster could handle 1 major surgery at a time. Captain Wells could manage 1 critical patient. But Maria was beginning to realize they were facing a medical crisis that exceeded their facility's capabilities. The second helicopter touched down in a whirlwind of dust and rotor wash, and the casualty flow resumed with renewed urgency. The first stretcher carried a soldier with massive chest trauma. His breathing labored and irregular. Maria could see the paradoxical chest movement that indicated flailed chest, combined with what appeared to be a tension pneumothorax that was compromising his cardiac function. "This one needs immediate decompression," Maria called out. But Dr. Foster was already committed to the amputation surgery, and Captain Wells was dealing with the abdominal wound. There was no one available to perform the needle thoracostomy that could save this soldier's life. The second critical case was even worse. A young sergeant with what appeared to be severe abdominal trauma and possible spinal injuries from the blast. Her blood pressure was critically low, and Maria could see the distended abdomen that suggested massive internal bleeding. This patient needed immediate exploratory surgery to identify and control the source of hemorrhaging. Dr. Foster, Maria, called across the medical tent. "We need additional surgical capability. I have 2 criticals that need immediate intervention." Foster looked up from his surgery, his face flushed with concentration and stress. "I'm in the middle of vascular repair. Captain Wells is handling the other critical. You'll have to stabilize them until we can get to them." But Maria knew that stabilization wouldn't be enough. The chest trauma case needed immediate decompression, or he would die within minutes. The abdominal case needed surgical exploration, or she would exsanguinate before Foster could finish his current procedure. They were facing the kind of triage decision that haunted military medical personnel, choosing who to save when resources weren't adequate to save everyone. The radio crackled with additional bad news. "Mitchell Base, this is Falcon 7. We have reports of additional casualties from the convoy site. Possible additional medevac required, but we're taking sporadic fire in the area. Medical evacuation may be delayed." More casualties were coming. The helicopters were potentially grounded by enemy fire, and they were already overwhelmed by the cases they had. Maria looked around the medical facility and realized they were approaching a crisis point that would require decisions and actions beyond the scope of normal protocols. "Sergeant Vasquez," Captain Wells called out, "I need you to monitor the vital signs on my patient while I get additional IV access." Maria moved to comply, but her attention kept returning to the chest trauma case, who was deteriorating rapidly. His oxygen saturation was dropping despite supplemental oxygen, and his blood pressure was falling as the tension pneumothorax compressed his heart. She had maybe 5 minutes before he went into irreversible shock. The needle thoracostomy procedure was relatively straightforward. Identify the second intercostal space at the mid-clavicular line. Insert a large bore needle to release the trapped air that was compressing the lung. Maria had studied the technique extensively and had even practiced it on training mannequins, but she'd never performed the procedure on a living patient. More importantly, she wasn't authorized to perform advanced medical procedures without direct supervision from a physician. But Dr. Foster was committed to surgery for at least another hour. Captain Wells was managing her own critical case, and The patient in front of Maria was dying from a condition she knew how to treat. The military medical protocols were clear about scope of practice and chain of command, but those protocols assumed adequate staffing and resources. "Dr. Foster," Maria called out again, "the chest trauma case is deteriorating rapidly. His blood pressure is dropping, and he's showing signs of cardiac compromise. I think he has a tension pneumothorax that needs immediate decompression." Foster looked up briefly from his surgery, sweat beading on his forehead. "Can you get N4 started and push some fluids? I'll be with him as soon as I finish this vascular repair. Sir, I don't think he'll survive that long without decompression," Maria replied, her voice carrying more urgency than she'd intended. "Sergeant, I'm in the middle of a complex procedure here," Foster snapped. "Follow protocol and manage what you can manage." Maria looked down at the young soldier on the stretcher. He couldn't have been more than 20 years old, with the kind of fresh face that reminded her of her youngest brother. His breathing was becoming more labored, his skin was turning grayish, and his pulse was becoming thready and weak. In her medical textbooks, this was called the golden hour, the critical time period when prompt medical intervention could mean the difference between life and death. She had the knowledge to save this soldier's life. She had studied the procedure, understood the anatomy, and knew exactly what needed to be done. What she didn't have was the authority or the official training that would justify taking action beyond her designated role as a medic. The radio crackled, again with updates. From the convoy site, Mitchell Base, they advised we have confirmed additional casualties. At least 6 more wounded requiring medical evacuation. Hostile fire has decreased, but the area is not yet secure for helicopter operations. 6 more casualties coming, no available physicians to handle the cases they already had, and a young soldier dying from a condition that could be treated with a procedure that would take less than 2 minutes to perform. Maria looked around the medical facility and realized that everything she'd studied, everything she'd prepared for, had led to this moment. The question wasn't whether she could perform the needle thoracostomy. The question was whether she was willing to step outside her designated role and accept responsibility for the consequences. If she succeeded, she might save a life but face disciplinary action for exceeding her authority. If she failed, or if the patient died during the procedure, she could face court-martial for practicing medicine without proper authorization. But as she watched the young soldier's condition continue to deteriorate, Maria realized that the biggest risk wasn't to her career or her military standing. The biggest risk was to the soldier who would die if someone didn't act quickly and decisively. She looked at the needle thoracostomy kit in the emergency supplies, then back at the dying soldier. Dr. Foster was completely absorbed in his surgery. Captain Wells was managing her own critical case, and additional casualties were already en route. They were beyond the point where normal protocols and procedures could handle the situation. Maria made her decision. She opened the thoracostomy kit and began preparing for a procedure she'd never performed on a living patient, in a situation that would test everything she'd learned and studied during her years of independent medical education. The young soldier's life hung in the balance, and for the first time in her military career, Maria was about to discover what she was truly capable of achieving when lives depended on her actions rather than her obedience to protocol. The crisis was no longer just about managing casualties within established procedures. It had become a test of whether she was willing to risk everything to save the lives of soldiers who had no one else to depend on in their moment of greatest need. Maria's hands trembled slightly as she held the needle thoracostomy kit, the weight of the decision pressing down on her like a physical force. Around her, the medical facility buzzed with controlled chaos. But in this moment, her world had narrowed to the dying soldier in front of her, and the procedure she'd studied hundreds of times but never performed under these circumstances. "Second intercostal space, midclavicular line," she whispered to herself. reciting the anatomical landmarks she'd memorized from countless hours of study. The soldier's breathing had become increasingly labored, his oxygen saturation dropping below 80% despite high-flow oxygen. His jugular veins were distended, a classic sign that the pressure in his chest was preventing blood from returning to his heart. She positioned the large-bore needle over the insertion site, feeling for the anatomical landmarks through his uniform. His ribs were clearly defined beneath her fingers, and she could visualize the underlying anatomy from the surgical text she'd studied. The needle needed to go just above the third rib to avoid the neurovascular bundle, angled slightly toward the shoulder, deep enough to penetrate the pleural space, but not so deep as to puncture the lung itself. Vasquez. Captain Wells' sharp voice cut through her concentration. What are you doing with that kit? Maria froze, the needle positioned but not yet inserted. Ma'am, this patient has a tension pneumothorax. His blood pressure is dropping and his cardiac output is compromised. He needs immediate decompression. Wells glanced over from her own patient, taking in the scene with obvious disapproval. Sergeant, you know you're not authorized to perform that procedure. Dr. Foster needs to handle all invasive interventions. Dr. Foster is in surgery, ma'am, Maria replied, her voice steady despite the adrenaline coursing through her system. This patient doesn't have time to wait. Then we follow protocol and do what we can until the doctor is available, Wells snapped. Put that kit down and help me with 4 access on my patient. Maria looked down at the young soldier beneath her. Hands. His lips were turning blue despite the oxygen mask, and his pulse was becoming increasingly weak and rapid. She'd read about this exact scenario in her medical textbooks. The progression from tension pneumothorax to cardiac arrest was predictable and rapid. Without immediate decompression, this soldier would be dead within minutes. Ma'am, with respect. This patient will die if we don't act now, Maria said, her voice carrying a conviction that surprised even her. I've studied this procedure extensively. I know I can do it safely. Captain Wells' expression hardened. Sergeant Vasquez, you are a combat medic, not a physician. You do not have the training or the authority to perform invasive procedures, regardless of what you think you've learned from reading books. The dismissal in Wells' voice was familiar, the same tone Maria had heard countless times during her deployment. Just a medic. Someone whose opinion didn't matter when real medical decisions needed to be made. But as she looked at the dying soldier, Maria realized that this moment was different from all the others. This wasn't about hierarchy or protocol, or military chain of command. This was about a young man's life hanging in the balance. I understand the protocol, ma'am, Maria said quietly, but I also understand that protocols assume adequate resources and personnel. We're beyond that point now. She made her decision. The needle slid smoothly through the chest wall, and Maria felt the slight give as it penetrated the pleural space. Immediately, there was a sharp hiss of escaping air, the sound of pressure being released from the soldier's chest cavity. His oxygen saturation began climbing almost immediately, and the blue tinge around his lips started to fade as proper circulation resumed. There, Maria said, securing the needle in place with tape. Tension pneumothorax decompressed. Patient's vitals should stabilize now. Captain Wells stared at her in stunned silence, clearly processing what had just happened. Maria had directly disobeyed orders and performed a procedure outside her scope of practice. But the results were undeniable. The soldier's breathing had improved dramatically. His color was returning to normal, and his blood pressure was stabilizing. Sergeant Vasquez, Wells said slowly, her voice containing a mixture of anger and confusion. You just performed an unauthorized medical procedure. Yes, ma'am, I did, Maria replied, continuing to monitor the patient's vital signs. And it saved his life. Before Captain Wells could respond, Dr. Foster's voice called out from the surgical bay. How are we doing with the other casualties? I'm finishing up the vascular repair here. Wells looked between Maria and the soldier. She'd just treated, clearly struggling with how to handle the situation. The procedure had been successful, the patient was stable, but Maria had crossed a line that wasn't supposed to be crossed by enlisted medical personnel. The chest trauma case has been stabilized, Wells replied carefully. Sergeant Vasquez performed a needle thoracostomy. There was a pause in Foster's surgical activity. Vasquez performed what? A needle thoracostomy, sir, Maria called out. The patient had a tension pneumothorax and was deteriorating rapidly. I decompressed the chest and his vitals have stabilized. Dr. Foster emerged from behind the surgical curtain, his gloves and scrubs splattered with blood from the amputation surgery. His expression was unreadable as he approached Maria's treatment area and examined the patient. Proper needle placement, he observed, checking the insertion site and listening to the patient's breathing. Good bilateral breath sounds, improved oxygen saturation. He looked up at Maria with an expression she'd never seen before. How did you know to perform this procedure? I've studied advanced trauma management extensively, sir, Maria replied. I recognized the signs of tension pneumothorax and knew the patient wouldn't survive without immediate decompression. Foster was quiet for a moment, processing both the medical situation and its implications. Sergeant, you understand that performing procedures outside your scope of practice is a serious violation of military medical protocols. Yes, sir, I understand that. And you also understand that if this procedure had gone wrong, if you'd caused a pneumothorax or injured the patient, you could face court-martial for practicing medicine without a license? Yes, sir, I understand that too. Dr. Foster looked down at the soldier, whose color had returned to normal and whose breathing was steady and regular. But you did it anyway. The patient was dying, sir. Someone had to act. The radio crackled with an update from the convoy site. Mitchell Base, this is Angel Flight 3. We're inbound with 6 additional casualties, ETA 10 minutes. We have 3 critical cases including possible traumatic brain injury and severe abdominal trauma. Weather is deteriorating, and this may be our last flight of the night. The implications hit everyone in the medical facility simultaneously. 6 more casualties were incoming, including cases that would require extensive surgical intervention. Dr. Foster was just finishing one complex surgery. Captain Wells was managing her critical case, and they were already operating beyond their normal capacity. Dr. Foster, Maria said carefully, based on the injury descriptions, at least 2 of those incoming cases will require immediate surgical intervention. We don't have the staffing to handle multiple simultaneous surgeries. Foster looked around the medical facility, clearly calculating their resources against the incoming casualties. You're right. We're going to need to make some difficult decisions about resource allocation. Sir, Maria continued, I've studied advanced surgical techniques. If you needed assistance with complex procedures, I could provide more than basic medic support. Captain Wells looked shocked. Sergeant, you're talking about assisting in major surgery. That requires years of training and certification. Ma'am, I have 4 years of pre-med education and extensive independent study of surgical techniques, Maria replied. I'm not claiming to be a surgeon, but I have knowledge that goes beyond basic medic training. Dr. Foster was studying her with renewed interest. What exactly have you studied, Sergeant? Advanced trauma surgery, vascular repair techniques, abdominal surgery, orthopedic procedures, Maria listed. I've read Morrison's Advanced Trauma Surgery cover to cover multiple times. I've studied Greenfield's surgery, scientific principles and practice. I know anatomy, physiology, and surgical principles. Reading about surgery and performing surgery are very different things, Foster observed. Yes, sir, they are. But, right. Now you need someone who understands surgical principles and can provide intelligent assistance. I'm the most qualified person available for that role. The sound of helicopter rotors was growing louder as the third wave of casualties approached. Foster looked at the needle thoracostomy Maria had performed, then at the stable patient whose life she'd saved, then back at her. "If I were to consider allowing you to assist in surgery," he said slowly, "I would need absolute assurance that you understand the limits of your role and the gravity of the situation." "I understand completely, sir. You would be assisting, not operating. You would follow my instructions precisely, without deviation or independent decision-making." "Yes, sir." Captain Wells intervened. "Dr. Foster, this is highly irregular." "Sergeant, Vasquez doesn't have the proper training or certification for surgical assistance." "Captain," Foster replied, "we're facing a mass casualty situation that exceeds our normal capabilities. I need someone who can provide intelligent support during complex procedures. Sergeant Vasquez has demonstrated both knowledge and judgment today." He paused, looking around the medical facility as the helicopter touched down outside. "Besides, our choice isn't between ideal circumstances and irregular circumstances. Our choice is between having qualified help and trying to handle multiple critical surgeries with inadequate support." The casualty flow resumed as stretcher bearers rushed through the entrance with the latest wounded soldiers. The first case was immediately recognizable as the traumatic brain injury, a young corporal with obvious skull fractures and altered mental status. The second was the abdominal trauma, a staff sergeant with distended abdomen and signs of massive internal bleeding. "These two need immediate surgical intervention," Foster observed, quickly examining both patients. "The brain injury needs neurosurgical evaluation, but we don't have neurosurgical capability here. The abdominal case needs exploratory surgery to control bleeding." Maria was already moving, setting up surgical instruments and preparing the operating area with the efficiency of someone who'd studied not just medical procedures, but surgical workflow and organization. "Dr. Foster," she said, "the brain injury case should be stabilized and prepared for medical evacuation to a higher-level facility. Our focus should be on the abdominal trauma, which we can handle here with proper surgical intervention." Foster nodded approvingly. "Good assessment. Captain Wells, can you manage the brain injury case and coordinate with medical evacuation?" "Yes, sir," Wells replied, though her expression suggested she was still processing the rapid changes in their team dynamics. "Sergeant Vasquez," Foster continued, "scrub in. You're going to assist me with an exploratory laparotomy to identify and control the source of this patient's internal bleeding." As Maria began scrubbing her hands and arms according to proper surgical protocol, she felt a strange sense of inevitability about the moment. Everything she'd studied, every hour she'd spent reading surgical textbooks and memorizing procedures, had been leading to this point. She was about to step into a role that went far beyond what anyone had expected from just a medic. But as she looked at the wounded soldiers around her, Maria realized that this wasn't about exceeding expectations or proving her capabilities. This was about using every tool and skill at her disposal to save lives, regardless of the artificial boundaries created by military hierarchy and bureaucratic protocol. She was still just a medic, according to her official designation. But tonight, she was going to discover what just a medic could accomplish when necessity and knowledge combined with the determination to save lives at any cost. The surgical lights cast harsh shadows across the operating table as Maria completed her scrub-in procedure, her movements precise and methodical, despite the adrenaline coursing through her veins. She'd observed this ritual countless times, but never as a primary participant in a life-saving surgery. The wounded staff sergeant lay unconscious on the table, his abdomen distended with internal bleeding that threatened to kill him within the hour. "Sergeant Vasquez," Dr. Foster said as he positioned himself at the patient's right side, "I need you to understand that what we're about to do goes far beyond normal medic responsibilities. You'll be functioning as a surgical assistant. in a complex procedure that could determine whether this soldier lives or dies. "I understand, sir," Maria replied, taking her position across from Foster. Through the sterile draping, she could see the patient's vital signs on the monitor: blood pressure dropping steadily, heart rate climbing into dangerous territory, oxygen saturation beginning to fluctuate as shock set in. Good. Now, based on the mechanism of injury and the physical examination, we're dealing with probable liver laceration with possible splenic involvement. Foster continued, his voice taking on the focused tone of a surgeon preparing for a complex case. "Our primary objective is to identify the source of bleeding and achieve hemostasis before the patient exsanguinates." Maria nodded, her mind automatically cataloging the surgical steps she'd studied in Morrison's trauma surgery textbook. Exploratory laparotomy for abdominal trauma followed a systematic approach: rapid entry, immediate assessment for contamination, systematic examination of all intra-abdominal organs, control of bleeding, and repair of injuries in order of life-threatening. Priority. "Scalpel," Foster requested, and Maria handed him the blade with the kind of anticipation that comes from knowing exactly what instrument would be needed next. Her years of independent study had included not just surgical techniques, but also the workflow and choreography of complex procedures. Foster made his incision, a long vertical cut from the xiphoid process to the pubic symphysis that would provide maximum exposure to the abdominal cavity. As soon as he entered the peritoneum, dark blood began flowing from the wound, confirming their suspicions about significant internal hemorrhage. "Suction," Foster called out, and Maria was ready with the suction device, carefully clearing blood from the surgical field to improve visibility. The amount of blood loss was substantial, probably close to 2 liters based on the patient's vital signs and the volume they were removing from the abdomen. "There," Foster said, pointing with his forceps to a deep laceration in the right lobe of the liver. Grade 3 liver laceration with active bleeding from hepatic vessels. "We need to achieve immediate control." Maria had studied hepatic trauma extensively, knowing that liver injuries were among the most challenging surgical emergencies in military medicine. The liver's rich blood supply made hemorrhage control difficult, and the organ's position deep in the abdomen complicated surgical access. "Dr. Foster," she said carefully, "the laceration appears to extend into segment 6 of the liver. If we pack the area with laparotomy pads and apply direct pressure, we might be able to control the bleeding while we assess for other injuries." Foster looked up from the surgical field, surprised by the specificity of her observation. "You're familiar with hepatic segmental anatomy?" "Yes, sir. I've studied Quinault's classification system and the vascular supply patterns for each hepatic segment." "Impressive." Foster began placing laparotomy pads around the liver laceration, applying the kind of controlled pressure that would compress bleeding vessels without causing additional tissue damage. "Continue suctioning while I examine the spleen and other structures." As Foster systematically examined the patient's internal organs, Maria found herself anticipating his needs with an accuracy that surprised both of them. She handed him instruments before he asked for them, positioned retractors to optimize his view of critical structures, and managed suction to maintain a clear surgical field without interfering with his technique. "The spleen appears intact," Foster observed, "but I'm seeing some retroperitoneal hematoma that suggests possible renal involvement. Sergeant, can you increase the retraction on the right side so I can get better visualization of the kidney?" Maria adjusted the retractors with the confidence of someone who understood not just what Foster was asking for, but why he needed it. The retroperitoneal space was difficult to access during emergency surgery, but proper retraction could provide enough exposure to assess kidney damage without extending the surgical incision. "Kidney looks intact," Foster said after careful examination. "The hematoma is probably from venous bleeding that's already stopped. Our main concern is still the hepatic laceration." He removed the packing from around the liver and examined the injury more closely. The bleeding had slowed but not stopped completely, indicating that direct pressure alone wouldn't be sufficient for definitive hemorrhage control. "We're going to need to oversew the laceration," Foster announced. "Sergeant, I'll need 2-0 chromic. Suture on a large needle, and I want you to maintain gentle traction on the liver edge while I place the sutures." This was the moment Maria had been preparing for without knowing it. Everything she'd studied about hepatic surgery, every diagram she'd memorized of liver anatomy, every technique she'd read about for controlling hemorrhage from solid organ injuries, was about to be tested in a real surgical situation, with a soldier's life hanging in the balance. She positioned her hands carefully around the liver, applying just enough traction to give Foster clear access to the laceration without causing additional tissue damage. Her touch was gentle but confident, the result of understanding both the technical requirements of the procedure and the delicate nature of traumatized tissue. "Perfect positioning," Foster murmured as he began placing sutures. "Keep that exact traction while I work." As Foster carefully sewed the liver laceration, Maria found herself mentally following each step of the procedure, understanding not just what he was doing, but why each technique was necessary. The sutures had to be deep enough to capture bleeding vessels, but not so deep as to cause ischemia. The spacing had to be close enough to ensure hemostasis, but not so tight as to cut through friable tissue. "Excellent," Foster said as he completed the repair. "Bleeding appears to be controlled. Let's irrigate the abdomen and check for any other injuries we might have missed." Maria assisted with the irrigation, using warm saline to flush blood and debris from the abdominal cavity, while Foster conducted a final systematic examination of all intra-abdominal structures. It was methodical, thorough work that required both technical skill and anatomical knowledge. "Everything looks good," Foster concluded after several minutes of careful inspection. "No other injuries identified. Hemostasis appears adequate. No signs of contamination. We can begin closure." As they prepared to close the abdomen, Captain Wells appeared at the edge of the surgical field. She'd been managing the other casualties while Foster and Maria worked, but now she was observing their surgery with obvious interest. "How did it go?" she asked. "Very well," Foster replied. Sergeant Vasquez provided excellent assistance. Her knowledge of anatomy and surgical technique was unexpected. Wells watched as Maria began organizing the surgical instruments for closure, her movements efficient and purposeful. "I have to admit, I've never seen a medic function at that level during surgery." "She's not just any medic," Foster observed. "Her understanding of surgical principles is quite advanced. She anticipated my needs, understood the anatomical challenges, and provided assistance that was genuinely helpful rather than just following orders." As Foster began closing the abdominal incision layer by layer, Maria found herself reflecting on what had just happened. For the first time in her military career, she'd been able to use her full knowledge and capabilities in service of saving a life. The artificial limitations imposed by her rank and designation had been temporarily set aside, allowing her to contribute at the level her education and training had prepared her for. "Sergeant," Foster said as he placed the final skin. "Sutures, I have to ask you something directly. Where did you learn surgical technique? Your instrument handling, your understanding of anatomy, your ability to anticipate surgical needs. That's not something you get from standard medic training." "I completed 4 years of pre-medical education before enlisting, sir," Maria replied. "I was accepted to medical school but chose military service for family financial reasons. I've continued studying advanced medical topics throughout my deployment." Foster paused in his suturing to look at her directly. "You were accepted to medical school. Which schools?" "Johns Hopkins, Harvard, and Stanford, sir." The surgical suite fell silent except for the steady beeping of the patient's monitors, which now showed stable vital signs and adequate blood pressure. Captain Wells was staring at Maria with an expression of complete surprise. "Let me understand this correctly," Foster said slowly. "You gave up medical school at Johns Hopkins to enlist as a combat medic?" "My family needed immediate financial support, sir. Military service provided that opportunity, while medical school would have required 4 more years of education without income." Foster shook his head in amazement. "Sergeant, you just assisted in a complex trauma surgery with the skill level of someone who's completed surgical residency training. Your knowledge and technique are extraordinary." "Thank you, sir. No, you don't understand. What you just demonstrated isn't normal. Combat medics, even excellent ones, don't have the kind of advanced knowledge you just displayed. You understand surgical principles at a level that rivals some doctors I've worked with." The implications of Foster's words began to sink in around the medical facility. Maria wasn't just a competent medic who'd exceeded expectations. She was someone with genuine medical expertise who'd been functioning far below her actual capabilities because of military hierarchy and bureaucratic limitations. "Dr. Foster," Captain Wells said carefully, "if Sergeant Vasquez has this level of medical knowledge, shouldn't we be utilizing her capabilities more effectively?" "That's exactly what I'm thinking," Foster replied. "We're in a combat zone with limited medical resources and a constant flow of complex casualties. Having someone with advanced medical knowledge available could make a significant difference in patient outcomes." The radio crackled with an update from the command post. "Medical, this is Mitchell Base Operations. Be advised, intelligence reports suggest increased enemy activity in the area. Additional convoy operations are likely, which means potential for more mass casualty events." Foster looked around the medical facility, taking in the 6 casualties they'd just treated, the surgical equipment that would need to be cleaned and sterilized, and the reality that they could face similar challenges again within hours. "Sergeant Vasquez," he said, "I'm going to recommend to the base commander that you be given expanded medical responsibilities. Your performance tonight demonstrated capabilities that go far beyond standard medic duties." "Sir, I appreciate that, but I understand if military protocol doesn't allow for—" "Sergeant," Foster interrupted, "tonight you saved at least 2 lives through procedures that required advanced medical knowledge and excellent judgment. The needle thoracostomy was performed perfectly, and your surgical assistance was at the level of a trained professional. Protocol is important, but results matter more." As they completed the post-operative care for their patients and began cleaning up the surgical area, Maria realized that something fundamental had changed. She was still officially just a medic, but everyone who'd witnessed her performance now understood that designation was no longer accurate. Dr. Foster was already making notes for his official report, documenting not just the successful surgeries, but also Maria's exceptional contributions. Captain Wells was reviewing the evening's events with obvious admiration for Maria's skills and knowledge, but Maria knew that tonight's success would bring new challenges and expectations. Word would spread about the medic who'd performed complex medical procedures during a mass casualty event. Some would see her as a valuable resource whose capabilities should be fully utilized. Others might view her as someone who'd overstepped boundaries and violated established protocols. As she checked on their post-operative patients one final time, Maria realized that she'd crossed a line that couldn't be uncrossed. She was no longer content to function within the artificial limitations of her designated role. Tonight had shown her what she could accomplish when her knowledge and skills were fully engaged in the service of saving lives. The question now was whether the military system would adapt to recognize and utilize her true capabilities, or whether she'd face resistance from those who preferred the predictability of established hierarchies over the complexity of individual excellence. Either way, Maria knew that she would never again be satisfied with being just a medic. Tonight had awakened something in her that demanded more, for herself and for the soldiers whose lives depended on the quality of medical care they received in their moment of greatest need. The morning briefing at Fob Mitchell carried an undercurrent of tension that hadn't been present before Maria's surgical performance. Word had spread through the base's tight-knit community with the speed that only military gossip could achieve. The medic who'd saved multiple lives during the convoy ambush had become the subject of conversations in mess halls, guard posts, and command bunkers throughout the compound. Maria sat in the medical staff meeting, listening as Dr. Foster presented his formal recommendation to Lieutenant Colonel James Patterson, the base commander. Patterson was a career infantry officer whose understanding of medical operations was limited, but whose respect for results was absolute. "Sir, based on Sergeant Vasquez's performance during last night's mass casualty event, I'm recommending that she be given expanded medical responsibilities," Foster said, his voice carrying the authority of someone who'd witnessed extraordinary competence under pressure. "Her knowledge and surgical skills exceed those of many medical personnel I've worked with in civilian hospitals." Lieutenant Colonel Patterson studied Maria with the calculating gaze of a commander trying to assess an unexpected asset. "Sergeant, Dr. Foster's report indicates you performed procedures typically reserved for physicians. How did you acquire this level of medical expertise?" "Sir, I completed undergraduate pre-medical education and was accepted to several medical schools before enlisting," Maria replied. "I've continued advanced medical studies throughout my deployment to maintain and expand my knowledge base." "Medical schools," Patterson repeated. "Which ones?" "Johns Hopkins, Harvard Medical School, and Stanford, sir." The room fell silent. Captain Wells, who'd been skeptical of Maria's capabilities just days earlier, was now looking at her with something approaching awe. Even the administrative staff present for the briefing seemed to recognize the significance of what they'd just heard. "Let me understand this correctly," Patterson said slowly. "We have a combat medic who is accepted to some of the most prestigious medical schools in the country, and she's been functioning as basic enlisted medical personnel?" "That's correct, sir," Foster replied. "Her performance last night demonstrated surgical knowledge and technique that suggests she could handle significantly more complex medical responsibilities." Patterson leaned back in his chair, processing. "The implications. What exactly are you proposing, Doctor?" "I'm recommending that Sergeant Vasquez be designated as a surgical assistant with authorization to perform advanced medical procedures under my supervision," Foster said. "Our medical capability would be substantially enhanced, particularly during mass casualty situations." Before Patterson could respond, the base communication system crackled to life with an urgent message. "All personnel, this is battalion operations. Intelligence reports indicate coordinated enemy offensive operations planned for this sector. Multiple targets identified, including Fob Mitchell. Medical personnel should prepare for potential mass casualty scenarios." The timing couldn't have been more perfect or more ominous. As if summoned by their conversation about enhanced medical capabilities, the threat of major combat operations loomed over their remote outpost. How quickly could this new arrangement be implemented? Patterson asked Foster. "Immediately, sir. Sergeant Vasquez has already demonstrated the necessary skills and judgment." "Very well. Sergeant Vasquez, you're hereby authorized to function as a surgical assistant under Dr. Foster's direct supervision. Captain Wells will coordinate the administrative details." As the briefing concluded and personnel dispersed to their duties, Maria found herself facing a reality she hadn't fully anticipated. Her exceptional performance had earned recognition and expanded responsibilities, but it had also placed her in a position where expectations would be higher and stakes more significant than anything she'd previously experienced. Dr. Foster approached her as she gathered her medical equipment. "Sergeant, I need you to understand what we've just committed to. If we face major combat operations, you'll be expected to perform at the level of a surgical resident. Are you prepared for that level of responsibility? Yes, sir, Maria replied, though privately she wondered if anyone could truly be prepared for what combat surgery might demand. Good, because intelligence suggests we're going to find out very soon. The next 48 hours brought a series of escalating challenges that tested every aspect of the medical team's enhanced capabilities. First came reports of increased insurgent activity throughout the region, followed by intelligence indicating that FOB Mitchell had been specifically targeted for attack due to its strategic location and medical facilities. They're trying to eliminate our medical capability, Major Sarah Chun, the base intelligence officer, explained during an emergency briefing. Taking out our ability to treat wounded soldiers would significantly impact morale and operational effectiveness throughout the region. The psychological warfare implications were clear. By targeting medical facilities and personnel, enemy forces could create fear and uncertainty that went far beyond the immediate tactical situation. Soldiers who knew they couldn't receive adequate medical care if wounded would be less willing to take risks or engage aggressively in combat operations. How many casualties should we prepare for? Foster asked. Worst case scenario, we could see 50 to 70 wounded soldiers if they successfully coordinate attacks on multiple convoys and patrol bases, Chun replied. Our normal capacity is maybe 20 casualties maximum. Maria felt her pulse quicken, not from fear, but from the recognition that they were approaching the kind of medical challenge that would require every skill and technique she'd ever studied. 50 casualties would mean multiple simultaneous surgeries, complex triage decisions, and the kind of sustained medical operations that tested both technical competence and physical endurance. Dr. Foster, she said, if we're facing that many casualties, we'll need to establish multiple surgical teams and streamline our triage processes. I could handle some surgical procedures independently while you manage the most complex cases. Foster looked at her sharply. Sergeant, independent surgical procedures would go beyond what we discussed. That's practicing medicine without proper authorization. Sir, if we have 50 casualties and only one surgeon, some patients will die. Waiting for treatment that I could provide, Maria replied. The question is whether we're going to let protocol prevent us from saving lives. It was the same argument she'd made about the needle thoracostomy, but now the stakes were exponentially higher. Instead of one dying soldier, they were potentially talking about dozens of wounded personnel who might not receive timely care because of artificial limitations on her medical practice. Before Foster could respond, the first test of their enhanced capabilities arrived in the form of a helicopter bearing casualties from a patrol that had encountered an improvised explosive device. 3 soldiers with varying degrees of blast trauma, including one with severe facial injuries that would require immediate surgical intervention. This is just the beginning, Foster muttered as they prepared to receive the casualties. If intelligence is correct, we'll see 10 times this number before the operation is over. The facial trauma case presented exactly the kind of complex challenge that would test Maria's advanced knowledge. The soldier had suffered massive soft tissue damage from metal fragments, including injuries to his airway that made breathing difficult and threatened his ability to survive transport to a higher-level medical facility. We need to establish a surgical airway, Foster said, examining the patient's injuries. The facial swelling and tissue damage make intubation impossible through normal methods. Maria was already preparing the cricothyrotomy kit, anticipating the procedure that would be necessary to save the soldier's life. A surgical airway was a high-risk procedure that required precise anatomical knowledge and steady hands, but it was often the only way to ensure adequate breathing in cases of severe facial trauma. Sergeant, I'll perform the cricothyrotomy while you prepare for facial reconstruction surgery, Foster said. Sir, I could handle the airway procedure while you focus on the surgical repair, Maria offered. It would be more efficient and allow you to concentrate on the more complex reconstruction work. Foster hesitated, clearly torn between recognizing Maria's capabilities and maintaining appropriate medical supervision. Sergeant, cricothyrotomy is a high-risk procedure. If something goes wrong, Dr. Foster, Maria interrupted gently, you've seen my surgical skills. You know I understand anatomy and technique. This soldier needs the best possible care, and that means utilizing all available expertise efficiently. It was a moment that crystallized the tension between protocol and practical necessity. Foster could insist on performing all procedures himself, ensuring compliance with medical hierarchy, but potentially compromising patient care. Or he could trust Maria's demonstrated competence and allow her to work at the level of her actual capabilities. All right, Foster said finally, perform the cricothyrotomy. I'll prepare for facial reconstruction. Maria positioned herself at the patient's neck, identifying the anatomical landmarks for the procedure with the confidence that came from extensive study of airway management techniques. The cricothyroid membrane was clearly palpable despite the facial swelling, and she could visualize the underlying anatomy from the surgical text she'd memorized. The procedure went flawlessly. Within minutes, she'd established a secure airway that allowed the patient to breathe normally while Foster began the complex work of repairing facial injuries. Working together, they completed both procedures in half the time it would have taken Foster to handle them sequentially. Excellent work, Foster said as they finished. Your technique was perfect, and the time savings allowed me to focus on optimal reconstruction rather than rushing through the airway management. But their success with the facial trauma case was immediately overshadowed by news from the intelligence center. Major Chun's voice came through the medical facility's communication system with an update that changed everything. Medical team. This is intelligence. We've intercepted communications indicating coordinated attacks beginning within the next 6 hours. Initial target appears to be the supply convoy returning from Kandahar, followed by simultaneous attacks on 3 patrol bases. Estimated casualties could exceed our worst-case projections. Foster looked at Maria with an expression that mixed admiration with concern. Sergeant, it appears we're about to face the ultimate test of our enhanced medical capabilities. How many casualties are we talking about? Maria asked. Based on the intercepted communications, potentially 80 to 100 wounded soldiers, Foster replied. That's more than our facility has ever handled, more than any single medical team should be expected to manage. The numbers were staggering. Even with Maria's expanded role, they were talking about a medical crisis that would require sustained operations for hours, possibly days. Complex surgeries, multiple simultaneous procedures, life and death triage decisions, and the kind of medical endurance that would test every aspect of their training and preparation. Dr. Foster, Maria said, her voice steady despite the magnitude of what they were facing. I think it's time to discuss what we're really capable of achieving together. What do you mean? I mean that if we're going to save 80 soldiers' lives, we need to function as a true surgical team rather than a doctor with an assistant, Maria replied. I can perform major surgical procedures independently. You know I can. The question is whether you're willing to trust me with that level of responsibility. Foster was quiet for a long moment, processing both the practical necessity and the professional implications of what Maria was proposing. Sergeant, what you're talking about would essentially make you a surgeon without medical school, residency training, or board certification. What I'm talking about is saving lives using whatever knowledge and skills are available, Maria replied. The wounded soldiers won't care about my credentials if I can stop their bleeding and repair their injuries. The radio crackled with another update. Medical, this is base operations. First attack has commenced. Convoy under heavy fire, multiple casualties confirmed. Medevac helicopters launching now. Foster looked around the medical facility, taking in their equipment, their capabilities, and the magnitude of the challenge approaching them. Sergeant Vasquez, if we do this, if we function as equal surgical partners during this operation, you'll be crossing a line that can never be uncrossed. I understand that, sir. You'll be performing surgery at a level that will demand recognition of your capabilities, regardless of military protocol or bureaucratic convenience. I understand that too. Foster nodded slowly. Then let's save some lives. As they began final preparations for what would become the most challenging medical operation in Fob Mitchell's history, Maria realized that everything she'd studied, everything she'd prepared for, and everything she'd dreamed of achieving was about to be tested in the crucible of combat surgery. She was no longer just a medic with advanced knowledge. She was about to become a combat surgeon, forged by necessity and proven by results under the most demanding circumstances imaginable. The first explosion shook Phoebe Mitchell at 13:47 hours, close enough to rattle surgical instruments and send dust cascading from the medical tent ceiling. Maria didn't pause in her preparation of the surgical bay, her hands continuing their methodical organization of instruments while her mind processed the sound's implications. The coordinated attack had begun, and somewhere in the mountains, American soldiers were fighting for their lives. Incoming wounded. The radio crackled with the voice of Angel Flight 1's crew chief. Multiple critical casualties from the convoy ambush. Ada 4 minutes. Be advised, the landing zone is taking sporadic mortar fire. Dr. Foster looked up from his own preparations, his face grim with determination. Sergeant, this is it. You ready? Ready, sir, Maria replied, though she knew that no amount of preparation could fully anticipate what the next several hours would demand of them. The helicopter appeared over the ridgeline through a haze of smoke and dust, its engines straining as the pilot maneuvered through intermittent artillery fire. Even before it touched down, Maria could see blood on the aircraft's exterior, evidence of the carnage it carried. The first casualty off the helicopter was a young lieutenant with massive abdominal trauma, his uniform soaked with blood and his breathing rapid and shallow. Maria's assessment was immediate and decisive. Penetrating abdominal wound with probable liver involvement. Blood pressure critically low, immediate surgical intervention required. Bay 1. She called out, directing the stretcher team. This one's mine. Sergeant, Foster started to object. Sir, you take the chest trauma case coming off the second bird. Maria interrupted, her voice carrying absolute authority. I can handle the abdominal surgery. Foster hesitated for a moment, then nodded. They'd crossed the line from traditional hierarchy to functional partnership, based on capability and necessity. The wounded soldiers needed the best possible care, and that meant utilizing every available skill without regard for conventional protocol. As Maria began scrubbing in for what would be her first independent surgery under combat conditions, another explosion rocked the base, this one close enough to cause a brief power fluctuation. The generator backup kicked in immediately, but the message was clear. They were operating under direct fire, with enemy forces close enough to threaten the medical facility itself. Medical, this is base operations, came the radio call. B. Advised, we have multiple inbound helicopter flights with casualties. Current count is 37 wounded, with more expected as patrol bases report contact. 37 casualties, with Maria and Foster as the only surgical capability. Even working simultaneously, they were facing a workload that would require sustained operations for hours. Maria looked down at the unconscious lieutenant on her operating table and made a silent promise. She would save every life that her skills and endurance could possibly preserve. The surgery began with a precise abdominal incision, revealing the damage she'd anticipated. A severe liver laceration with active bleeding from multiple hepatic vessels. But as she began controlling the hemorrhage, Maria discovered additional injuries that complicated the procedure significantly. The shrapnel that had damaged the liver had also perforated the small bowel in 3 locations and caused a retroperitoneal hematoma that suggested kidney involvement. Multiple organ trauma, she announced to Captain Wells, who was monitoring anesthesia. I'm going to need extended operating time to repair all the injuries. How extended? Wells asked, her voice tense with the knowledge that other critical cases were waiting. At least 3 hours for complete repair, Maria replied, her hands already working to control liver bleeding while assessing the bowel perforations. But I can achieve life-saving hemorrhage control in 30 minutes, then move to the next critical case and return to complete the reconstruction later. It was a decision that epitomized combat surgery, prioritizing life-threatening injuries while deferring less critical repairs to maximize the number of patients who could be saved. Maria was thinking like a trauma surgeon, balancing individual patient needs against the demands of mass casualty care. As she worked to repair the liver laceration, the sounds of combat intensified around the medical facility. Automatic weapons fire echoed from the perimeter, punctuated by the sharp crack of mortar and the deeper rumble of artillery. Through the tent walls, she could hear shouted commands as base defense forces responded to probing attacks. Medical. This is perimeter defense, came an urgent radio call. We have enemy forces attempting to breach the eastern wire. Medical personnel should prepare for possible evacuation or defense of the facility. Foster looked up from his own surgery, a complex chest procedure to repair damage from multiple shrapnel wounds. Sergeant, if we have to evacuate, we'll lose these patients. Then we don't evacuate, Maria replied, continuing her liver repair without missing a suture. These soldiers trusted us with their lives. We finish what we started. Over the next hour, the situation around Fob Mitchell deteriorated dramatically. Enemy forces launched coordinated attacks on 3 sides of the base, forcing defensive operations while helicopters continued arriving with wounded soldiers. The medical facility became an island of focused calm within a storm of violence, with Maria and Foster working to save lives while gunfire and explosions provided a constant soundtrack. Incoming! Someone shouted as a mortar round exploded less than 50 meters from the medical tent. The blast wave caused surgical lights to swing wildly and sent equipment rattling across metal tables. But neither Maria nor Foster paused in their procedures. How many more casualties are inbound? Foster called out during a brief lull in his surgery. Angel Flight 6 reports 12 more critical cases en route, Wells replied. Current facility count is 43 wounded, with 18 requiring immediate surgical intervention. The numbers were staggering. Even with both surgical bays operating continuously, they were facing a backlog of critical cases that would require hours to clear. Maria completed her hemorrhage control on the liver case and quickly moved to the next patient, a staff sergeant with severe extremity trauma that threatened limb loss if not immediately addressed. Vascular compromise in the left leg, she diagnosed. After rapid examination, I need to restore blood flow within the next 30 minutes or we'll be looking at amputation. As Maria began the delicate work of vascular repair, she became aware that something extraordinary was happening around her. Despite the chaos of combat operations and the overwhelming number of casualties, the medical team was functioning with unprecedented efficiency. Foster was completing complex procedures with remarkable speed while maintaining excellent surgical technique. Wells was managing multiple anesthetic cases simultaneously. Even the medics and support staff were performing beyond their normal capabilities. It was as if the crisis had elevated everyone's performance to match the demands of the situation. Maria realized she was witnessing the kind of medical teamwork that emerged only under the most extreme circumstances, when conventional limitations were swept aside by the imperative to save lives. Dr. Foster, she called out as she completed the vascular repair, I'm going to set up a second surgical table. We can increase our throughput if I take the orthopedic cases while you handle the internal trauma. Do it, Foster replied immediately. We need to clear the critical backlog before we lose patients to delayed treatment. As Maria established the second surgical station, another wave of casualties arrived from a patrol base that had been overrun. The helicopter crew chief's report was grim: 8 critical cases, including possible head trauma and multiple amputations. The patrol base was completely destroyed. These may be the only survivors. The head trauma case was beyond their surgical capability, requiring neurosurgical intervention that only a major medical center could provide. But the amputation cases were exactly the kind of challenge that Maria's extensive study of orthopedic surgery had prepared her to handle. I'll take the amputations, she told Foster. You focus on the internal injuries. Working on adjacent tables, Maria and Foster began what would become an 8-hour surgical marathon. Case after case flowed through their makeshift operating theater, penetrating abdominal wounds, severe extremity trauma, chest injuries, complex orthopedic reconstructions. Each patient presented unique challenges that required all of Maria's accumulated knowledge and technical skill. Around the 4th hour of continuous surgery, as enemy fire intensified around the base perimeter, Maria realized that something fundamental had changed in her understanding of medicine and her role as a healer. She was no longer thinking about protocols, credentials, or military hierarchy. She was functioning purely as a surgeon, using every tool at her disposal to preserve life and restore function to damaged bodies. Sergeant, Foster said during a brief break between cases, you're performing surgery at a level that rivals any trauma surgeon I've worked with. Your technique, your decision-making, your endurance, it's all exceptional. Thank you, sir, Maria replied, already preparing for the next case. No, you don't understand, Foster continued. What you're doing tonight isn't just good medic work, or even good surgical assistance. You're practicing medicine at the level of a board-certified surgeon. That's not an opinion. That's an objective assessment based on watching you work for the past 4 hours. As if to emphasize his point, the next casualty required exactly the kind of complex procedure that tested every aspect of surgical skill. A young corporal with massive abdominal trauma, including liver laceration, splenic rupture, and possible pancreatic injury. It was the kind of case that would challenge even experienced trauma surgeons. This one's yours, Foster said. I'll handle the chest case that just came in. As Maria began the most complex surgery of her life, working to repair multiple organ injuries while maintaining the patient's cardiovascular stability, she realized that Foster was right. She wasn't just performing procedures she'd read about in textbooks. She was making complex surgical decisions, adapting techniques to unique circumstances, and managing complications that required genuine surgical expertise. The pancreatic injury was particularly challenging, requiring careful dissection and precise suturing to avoid creating a leak that could be life-threatening. As she worked, Maria found herself drawing on knowledge from multiple medical disciplines: anatomy, physiology, pathology, pharmacology, and surgical technique, all integrated into a seamless approach to patient care. 6 hours into the surgical marathon, with dozens of successful procedures completed and multiple lives saved, Maria experienced a moment of perfect clarity about her identity and purpose. She was no longer a medic pretending to be a surgeon, or someone with potential waiting to be recognized. She was a surgeon, fully realized and completely committed to the practice of medicine at its highest level. Medical, this is base operations. Came a radio call that would test her transformation one final time. We have a critical casualty inbound, possible internal bleeding, but the helicopter took fire during extraction. The aircraft is damaged and may not make it to the landing zone. How far out? Foster asked. 2 clicks, but losing altitude rapidly. They may have to attempt an emergency landing outside the perimeter. Maria looked at Foster, both of them recognizing the implications. A critically wounded soldier, possibly dying from internal bleeding, stranded outside the base defenses in an area controlled by enemy forces. "I'll go," Maria said simply. "Sergeant, that's not a medical mission. That's a combat rescue operation. That's a dying soldier who needs surgical intervention that only I can provide," Maria replied. "If he has internal bleeding, he won't survive transport back to the base. Someone needs to perform emergency surgery in the field." Foster stared at her, processing what she was proposing. Field surgery under enemy fire? That's beyond anything we've discussed. "Dr. Foster, 8 hours ago, I was just a medic. Tonight I performed surgery that saved more than 20 lives. Tomorrow, I'm going to save one more, regardless of where that surgery needs to happen." As Maria began gathering portable surgical equipment for what would become the ultimate test of her transformation from medic to surgeon, she realized that the young woman who'd entered the medical tent that evening no longer existed. In her place stood someone who would stop at nothing to preserve life, regardless of danger, protocol, or the artificial limitations that others might try to impose. She was no longer just a medic. She was Dr. Maria Vasquez, trauma surgeon. Ready to practice medicine wherever wounded soldiers needed her expertise, the armored vehicle lurched violently as it navigated the rocky terrain beyond Phoebe Mitchell's perimeter, its reinforced hull absorbing the impact of small arms fire from concealed enemy positions. Maria crouched in the back compartment, her portable surgical kit secured against her chest, watching the landscape through reinforced windows as they approached the crash site, where a critically wounded soldier waited for medical intervention that could only be provided under combat conditions. Sergeant First Class Mike Torres, the vehicle commander, spoke into his radio headset while scanning for threats. "Overwatch 1, this is Rescue 6, approaching crash site. Visibility limited by smoke and terrain. Request immediate suppression of enemy positions to the north." The radio crackled with the response. "Rescue 6, Overwatch 1, we have eyes on multiple hostile positions. Beginning suppression fire now. You have a narrow window for medical operations." Maria felt her pulse steady as they approached their destination, her mind shifting into the focused state that had sustained her through 8 hours of continuous surgery. The knowledge that she was about to perform emergency surgery in an active combat zone should have been terrifying, but instead she felt the same clarity of purpose that had guided her through every complex procedure she'd completed that night. Crashed helicopter lay on its side in a small clearing, its rotors twisted and its fuselage cracked open like a broken egg. Smoke poured from the engine compartment, and Maria could see bullet holes stitched across the aircraft's exterior. Somehow, the crew had managed to maintain power to their radio long enough to call for help, but the situation was deteriorating rapidly. "There," Torres pointed toward the wreckage. "I can see movement near the cabin." As their vehicle came to a stop behind a cluster of boulders that provided cover from enemy fire, Maria began her final equipment check. Portable surgical instruments, emergency medications, blood products, and everything needed to perform life-saving surgery in conditions that no medical school or residency program could possibly prepare someone for. "Doc," Torres said, using the title that had somehow become natural during their brief journey, "we can give you maybe 20 minutes before enemy fire becomes too intense. After that, we'll have to extract them regardless of the medical situation." 20 minutes will be enough," Maria replied, surprising herself with the confidence in her voice. "If this soldier has internal bleeding, I can achieve hemostasis and stabilize him for transport in that time frame." Torres nodded, impressed by her certainty. During the ride to the crash site, he'd been briefed about the medic who'd spent the night performing surgery that saved dozens of lives. What he hadn't expected was the quiet authority she displayed, the way she spoke about complex medical procedures with the assurance of someone who'd proven her capabilities under the most demanding circumstances imaginable. "Team ready," Torres announced to his crew. "Medical mission. Provide security for field surgery. Watch your fields of fire and keep the dock protected." As they emerged from the vehicle, Maria immediately heard the distinctive sound of a wounded soldier calling for help. Following the voice, she found the helicopter's crew chief, Staff Sergeant Janet Rodriguez, conscious but pale, applying pressure to a severe abdominal wound while trying to maintain the airway of an unconscious pilot. Medical personnel. Rodriguez called out as Maria approached. "Captain Williams has been unconscious for 15 minutes. Possible head trauma. I've got a penetrating abdominal wound, losing blood fast." Maria's assessment was rapid and systematic, the product of years of study and hours of recent surgical experience. The pilot showed signs of severe concussion, but his airway was clear and his breathing was adequate. Rodriguez had a penetrating abdominal wound with active bleeding that suggested major vessel involvement. "Sergeant Rodriguez, you're my priority," Maria announced, beginning to unpack her surgical equipment. "Your bleeding is life-threatening and needs immediate surgical control." "What about Captain Williams? He's stable for now. I can monitor his neurological status while I work on your injuries." As Maria began establishing her field operating area, using the helicopter's cargo compartment as a makeshift surgical suite, the sound of gunfire intensified around their position. Torres and his team were engaging enemy forces that were attempting to advance on the crash site, their weapons providing a deadly barrier between Maria and the fighters who wanted to prevent any rescue attempt. "Contact left," one of Torres's soldiers called out. Multiple fighters moving through the tree line. Maria didn't pause in her preparations, her hands continuing their methodical organization of surgical instruments while explosions and gunfire raged around her position. This was medicine practiced at its most extreme, surgery performed under conditions that tested not just technical skill, but mental toughness and physical courage. "Sergeant Rodriguez, I'm going to give you local anesthesia and perform emergency surgery to control your bleeding," Maria explained as she prepared her patient. "This is going to be field surgery under combat conditions, but I've done this procedure many times tonight." Rodriguez looked up at her with eyes that mixed pain with trust. "Doc, I heard about what you did back at the base. If you can save lives under fire there, you can do it here too." As Maria made her incision, working to identify and control the source of Rodriguez's internal bleeding, she realized that something extraordinary was happening. Despite the chaos of combat operations around her, despite the completely unconventional surgical environment, her hands were steady and her mind was clear. Every suture was placed with precision, every decision made with confidence born from genuine expertise. The bleeding was coming from a lacerated mesenteric artery. Exactly the kind of injury that required immediate surgical intervention, but was relatively straightforward to repair for someone with advanced knowledge of abdominal anatomy. Maria clamped the vessel, tied it off, and checked for additional injuries with the efficiency of a surgeon who'd performed similar procedures dozens of times. "Bleeding controlled," she announced after 20 minutes of focused work. "No other injuries identified. Patient stable for transport." Torres appeared at her shoulder, his rifle ready but his expression amazed. "Doc, I've never seen anything like that. You just performed surgery under enemy fire like it was routine." "It is routine," Maria replied, beginning to pack her equipment. "Surgery is surgery, regardless of the environment. The patient's needs don't change because there are people shooting at you." As they prepared Rodriguez and Williams for transport back to Fob Mitchell, Maria reflected on what had just occurred. She'd performed emergency surgery in an active combat zone, saved a soldier's life under conditions that would have challenged any surgeon, and done it with the kind of calm professionalism that came from absolute confidence in her abilities. The return journey to the base took them through areas where fighting was still ongoing, But Maria found herself monitoring her patients' vital signs with the same focused attention she'd given to every case throughout the night. Rodriguez was stable, her bleeding controlled, and her color improving. Williams was regaining consciousness, responding appropriately to verbal commands. "Medical, this is Rescue 6 returning to base with 2 casualties," Torres radioed ahead. "Both patients have stable, excellent surgical intervention in the field." Dr. Foster's voice came back immediately. "Rescue 6, understood. Outstanding work. Prepare for immediate post-operative care upon arrival." When they reached Phoebe Mitchell, Maria was surprised to find a reception committee waiting for them. Dr. Foster, Captain Wells, Lieutenant Colonel Patterson, and several other medical personnel were gathered at the landing area, their expressions mixing relief with something approaching awe. "Sergeant Vasquez," Patterson said as they transferred the patients to the medical facility, "Dr. Foster has briefed me on tonight's operations. 43 casualties treated, multiple complex surgeries performed, and now a successful field surgery under enemy fire. That's extraordinary medical work under any circumstances." "Thank you, sir," Maria replied, but her attention was focused on getting Rodriguez and Williams into proper post-operative care. As the immediate medical needs were addressed and the patient stabilized, Dr. Foster approached Maria with an expression she'd never seen before. "Sergeant, I need to say something officially. What you accomplished tonight wasn't just exceptional medic work or even excellent surgical assistance. You performed as an independent surgeon with results that rival any trauma specialist I've worked with." "Dr. Foster." "No, let me finish," Foster interrupted. "I'm going to recommend you for immediate commissioning as a medical officer and fast-track acceptance to military medical school. Someone with your capabilities and proven performance belongs in medical school, not functioning as enlisted personnel." "Captain." Wells stepped forward, adding her voice to Foster's recommendation. "Sergeant, I owe you an apology. I underestimated your abilities because I couldn't see past your rank and designation. Tonight proved that you're not just a medic with advanced knowledge. You're a surgeon who happened to be wearing a medic's uniform." Lieutenant Colonel Patterson nodded in agreement. "Sergeant Vasquez, based on tonight's performance, I'm authorizing immediate promotion to Staff Sergeant and recommending you for the Army Commendation Medal with Valor. But more importantly, I'm endorsing Dr. Foster's recommendation for officer candidacy in medical school." As the formal recognition continued around her, Maria found herself thinking about the journey that had brought her to this moment. Less than 24 hours ago, she'd been just a medic, someone whose opinions and capabilities were consistently underestimated by those around her. Tonight, she'd saved more than 40 lives through surgical procedures that demonstrated mastery of medical knowledge and technique. "Sir," she said to Patterson, "I appreciate the recommendations, but I need you to understand something. I didn't perform tonight's surgeries to prove my capabilities or earn recognition. I did them because wounded soldiers needed medical care that I was qualified to provide." "That's exactly why you belong in medical school," Foster replied. "Your motivation is patient care, not personal advancement. That's the foundation of excellent medical practice." As the immediate aftermath of the night's operations continued, with casualty reports being filed and equipment being cleaned and restocked, Maria realized that something fundamental had changed in how everyone around her perceived her role and capabilities. She was no longer the medic who exceeded expectations. She was the surgeon who'd proven herself under the most demanding circumstances possible. 3 weeks later, as Phoebe Mitchell returned to routine operations and the wounded soldiers from that night continued their recovery, Maria received official notification of her acceptance to the Army's accelerated medical program. She would complete her medical degree and residency training with full military support, recognition of her demonstrated abilities, and a guaranteed position in military surgery upon completion. "Congratulations, Dr. Vasquez," Dr. Foster said. using the title that reflected her future rather than her current rank. You've earned this opportunity through performance that speaks for itself. As Maria prepared for the next phase of her journey, she reflected on the transformation that had occurred during those 8 hours of continuous surgery under enemy fire. She'd entered that night as someone whose capabilities were constrained by others' limited expectations. She was leaving as someone whose potential was limited only by her own. Determination to excel. The young woman who'd once been dismissed as just a medic no longer existed. In her place stood Dr. Maria Elena Vasquez, trauma surgeon, whose story would inspire future generations of medical professionals to recognize that true capability transcends artificial limitations and that excellence emerges when knowledge, skill, and determination combine in service of preserving life. She'd proven that sometimes the most extraordinary achievements come from people who refuse to accept others' definitions of what they're capable of accomplishing. The wounded soldiers whose lives she'd saved would carry scars that reminded them of the day they met a surgeon who happened to be wearing a medic's uniform, someone who'd shown them that in the right hands, medicine could triumph over any obstacle, including the artificial barriers created by protocol, hierarchy, and limited imagination. Maria's story was complete, but her journey as a surgeon was just beginning. The medic was gone, replaced by someone whose dedication to saving lives had transformed not just her own identity, but the understanding of what was possible when capability met opportunity in the crucible of combat medicine. Up next, you've got 2 more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from U.S.